Hello class, my name is Taylor Denham, and today I'll be talking about the alarming rates of maternal and infant mortality in African Americans. Maternal mortality is defined as the death of a woman while pregnant or within 42 days of termination of pregnancy. Maternal mortality rates are higher today than they were 25 years ago in the United States. As we can see on the first chart, maternal deaths in the US are on the rise. When comparing the United States, which is represented by the dark blue line, to other developed regions, which is represented by the light blue line, we could see that from 1990 to 2013, there has been a steady increase in the United States, while there has been a steady decrease in other developed regions. According to the CDC, there are about 700 to 900 maternal deaths yearly today, which is more than double what it was in 1993. Looking at the other chart focusing on maternal death rate in the United States, we could see that the average, which is represented by the dark black line, has been steadily increasing from 1987 to 2013. And looking below that, we see that the green dotted line, which is represented by white women, shows that although there has been a steady increase in maternal mortality rates, it is below average. But when we look at the purple dotted line, which represents the Black woman, it shows that not only has there been a rapid increase, but it has continuously been above average. This shows that African American women are 3 to 4 times more likely to die of maternal complications than white women. Infant mortality is defined as the death of an infant before they pass age 1. From 1915 to 1990, infant mortality rates decreased drastically in the United States, but since then, there has been a steady increase. In the first graph, we compare the United States to that of other developed regions and the rate of infant mortality, which is the rate of deaths per 1,000 live births. The United States is represented by the light blue graph at 6.1, which is higher when compared to other developed regions. Looking at the next graph, we see the rate of infant mortality in the United States from 2000 to 2010, broken up into 4 different categories. Although the rate has decreased in all categories from 2000 to 2010, we see that there is still a high number in Black infant rates from 2000 to 2010, which shows that Black infants are twice as likely to not make it past their first birthday when compared to white infants. So what is causing this gap? Is it the lack of education or access to healthcare that is contributing to these high rates? Or maybe it's one socioeconomic status. A study was conducted in 2017 that compared the education level and maternal and infant complications to see what was it possibly that was causing such high rates. And the study concluded that college-educated Black women were actually more likely to give birth prematurely than a white woman with a high school degree. It showed that Black women are at risk regardless of their socioeconomic status. So what really is causing this huge gap? Maybe it could be genetics. So a study was conducted comparing Black women born in the United States to non-Hispanic Black women born in the Caribbean and Africa. The study concluded that those who were born in Africa and the Caribbean showed a significantly lower risk than Black women who were born in the United States. So the question now is, what is happening with Black women growing up in the United States? Racism has been identified as a contributing risk factor. Racial prejudice has been linked to the high numbers of mortality in Black mothers and infants. Racial prejudice is a barrier for Black mothers to receive standard health care. There is a study that focused on counties with high racial prejudice compared to counties with low racial prejudice and the complications that mothers and infants endured. As a result, the study concluded that those who lived in counties with higher racial prejudice were at a higher risk than those who lived in counties with a lower racial prejudice. A healthy pregnancy and labor already increases stress levels naturally. But when a mother enters these journeys with already high stress levels, that's when the health complications start to occur. Black women are entering these life-changing events with racism-related stress. So what is being done to close this gap? There are actually multiple approaches and interventions being implemented, many being implemented just this year. The Institute of Medicine created a program called Healthy Start in order to eliminate disparities among Black women. They focus on 4 approaches, starting with bringing awareness to the public and professionals in the field, and requiring that health systems provide exceptional care to all, creating policies and regulating improvements for access to care for minorities and reducing cultural barriers, and ultimately expanding the education of not only patients but also providers. Next, there's the approach that was implemented by New York City Health and Hospitals. New York City invested over $12 million into this 5-year plan in order to encourage necessary providers to take bias training to better treat pregnant Black women who were their patients, and also to provide support to hospitals in order to amplify data tracking and analysis so that the quality of care can get better and that also preventable complications can decrease. And then to improve maternal care at all of their facilities and to increase education to the public alongside community-based organizations. Also, the state of New York had added doula services to be covered by Medicaid. Through a study, they realized that having one-on-one support could result in the decrease in C-sections. C-sections have become a huge concern as they seem to be overused in the United States. 33% of women in the United States receive a C-section, while the optimal percentage is around 19%. C-sections have been linked as a contributing factor to labor deaths. So by ultimately decreasing C-sections, the rate of labor deaths is likely to go down. Not only has one-on-one support seemed to decrease C-sections, it also has increased positive feelings on birth-giving experiences and provide continuous support to mothers, prenatal, perinatal, and also postpartum. So what are the future directions? Many of us have probably heard about the life-threatening experiences that Serena Williams and Beyonce have experienced through their last pregnancies. Speaking out about it has really brought awareness about this issue. A paper published by Duke University stated that policies and programs predicated on prioritizing healthy maternal and child outcomes for Black women due to their greater susceptibility to racism and discrimination have the potential to reduce the gap. So by policymakers and stakeholders coming together and implementing policies focused on Black women's risk factors and their needs during perinatal and postpartum care could help to reduce the gap. Identifying these risk factors and being involved can help to maximize the desired results. Organizations such as Equal Employment Opportunity Commission needs access to funding in order to create obstacles of discriminatory actions and actors. Discrimination is linked to higher levels of inflammation, systolic and diastolic blood pressure, among other health concerns. These health issues are contributing factors to infant and maternal mortality. A nationwide surveillance system of maternal and infant mortality is needed in order to help assess what is causing them and also to allow for opportunities to prevent them. In conclusion, racism has been identified as a contributing factor to the increasing rates in maternal and infant mortality in the Black population. Through programs such as the ones mentioned and access to health services such as doulas, bias training among healthcare professionals, and observing the need of unnecessary C-sections can help to lead to a decrease in these mortality rates. Thank you.